Good morning and welcome to this morning's webinar. Thank you for joining me and thank you for your interest in TMJ massage therapies, a whole body approach to TMJ dysfunction. This webinar I'm hoping will give you a little bit more information about the Level 1 TMJ Massage Therapies online CPD course that I run and will be running again in November. So I thought I'd just start by outlining what the session will cover. So I'm going to start by introducing myself and TMJ Massage Therapies. We will look at how TMJ dysfunction is presenting itself today in society. I will then discuss this idea that I live and breathe, and that's this whole body approach to TMJ dysfunction. I will outline an assessment protocol that you can use to assess TMJ dysfunction in your clinic. I will then look at the course suitability to discuss who this course is really for. We will look at the learning objectives and the learning outcomes of the course. I will cover the course structure and the content, and we'll then look at what is exactly included in the course. I will then just have a brief look at what past participants say so you can get an idea of what other practitioners and allied health practitioners have gained from the course. We will then outline the key dates for the online November course and then look at how you can register and finish with any questions. I will take the questions at the end offline. So if anyone who's catching up on this webinar at an alternative time, if you just want to drop me an email, or we can rearrange another Q&A session if that's something of interest for you at the end. Okay, so what brings me here today? So 14 years ago, I dislocated my jaw eating a bread roll. It was the worst day of my life. I used to work in marketing. I was very stressed. I had long commutes. I traveled a lot. My posture was very forward posture. I spent a lot of time on the laptop. I was absolutely unaware that I was clenching my jaw. I was unaware that this was even a thing until that morning I dislocated my jaw. And I guess that day was the day that changed my life. And I am forever grateful to be able to say that TMJ myofascial release, remedial massage, chiropractic treatment, and then other alternative holistic health therapies have fixed me. And, you know, that is my story. And that is what I guess I have now brought all the bits of the different modalities that fixed me and have brought them into a treatment that I would like to share with as many other people as possible. From that the day, or from my journey, as soon as my journey started with jaw pain and the dislocation, I was so inspired by all the different therapists that treated me that I went then to study a diploma of integrated body therapy at the Australasian College of Natural Therapy in Sydney. I then went on to work very closely with a chiropractor. And over time, I guess over years, 14 years now, I worked a lot with clients with jaw pain and developed my own treatment protocol known as TMJ Massage Therapies, a whole body approach to TMJ dysfunction. I am based here in Cornwall in the UK now. I relocated from Sydney 5 years ago now. And I'm able to offer this treatment to a number of clients, both near and far from me here. People travel quite some way to be treated. And I guess what I find is that this treatment, this whole body approach to TMJ dysfunction is so beneficial, so powerful and so life-changing that I'm just so inspired and want to share it with as many other practitioners so that you too can help your clients with jaw pain. It helped me, it's fixed me, and I'm now helping others and also wanting to inspire other practitioners to also help their my fellow jaw pain sufferers. I find that the jaw is a truly fascinating part of the body, so both physically and emotionally. Physically, it's the hardest working joint in the body. We use it, we eat, we talk, we clench, we grind our teeth. We are always using the jaw. So physically, and it's such an intricate structure, I find it absolutely fascinating. But I guess on another level, for me, it's the emotional level of the jaw and how much emotion we hold in that area. And certainly my course has a blend of those both elements. And that's kind of, for me, the most powerful in my treatment is having that idea and that concept of most physical and emotional release of the jaw to help treat and to free any dysfunction. So I guess that leads me to to my mission. So I, am now treating many clients and having very successful treatments of clients. And I'm now on a mission to share my journey and my knowledge and to eradicate jaw pain as much as I can throughout the world, because I know how life damaging jaw pain can be on quite a superficial level until it gets really sore, and then obviously it can have so many impacts of the body and mind. But then also I've seen how this treatment protocol can actually help so many clients and has brought so much freedom and physical but also emotional and mental well-being into my clients' lives. So that's kind of my story. And this is kind of a summary of it, really. So when I dislocated my jaw, I was friends with an editor of That's Life magazine in Australia. And she just thought it was, fascinating and great story. And that's where it all started, because I realized how common jaw pain was and how many people clench their jaw, grind their teeth at night, woke up with jaw pain every morning. I was absolutely none the wiser. I didn't even know it was a thing. Had tension headaches, this vice around their head. So many people wrote into the magazine to express that they could share the pain that I was suffering, and that's kind of what got me really intrigued by it. And 14 years later, I'm now known as this renowned leader in TMJ Dysfunction, and I invite you to go and check out my testimonials of all the clients that I have been able to treat successfully and the lives that I've changed because through using this whole body approach to TMJ Dysfunction. And from a client suffering with tinnitus for 8 years, I just recently had a client who was suffering with tinnitus for 8 years, jaw pain related, had severe jaw pain. After 2 treatments, her tinnitus has gone away, and that's incredible. That's amazing. And that is the reason why I'm sat here today sharing my journey with you, because I truly believe that this treatment protocol can help so many people, and I would just love more and more people to be jaw pain free, because it's not a pleasant thing. And there's so many jaw pain sufferers out there at the moment, particularly post-COVID or during COVID times, that this is the time now that practitioners, allied health practitioners, anyone treating jaw pain needs to be helping these clients eradicate their jaw pain. So that's why I'm here today. So let's just look at TMJ dysfunction today. And according to the British Association of Oral and Maxillofacial Surgeons, TMJ symptoms affect up to 25% of the population. I personally believe that figure will be much higher now. It'll be interesting to see where that figure goes in the next 2 years. Functional disorders of the temporomandibular joint in the contemporary population are considered by the World Health Organization to be the 3rd most frequent dental disease after caries and periodontitis. It's thought to affect 84% of the adult population. That's huge. 84% of the adult population are walking around or have experienced jaw pain. The research and understanding of TMJ dysfunction is constantly changing, and I think that's why this area is becoming more accepted, perhaps, that people are actually now trying to find out more about jaw pain, TMJ dysfunction, what's causing it, how can we treat it? And there are lots more scientific studies now proving how prevalent jaw pain is throughout the world. So it's an exciting time to be treating jaw pain. And now that there is that science behind it, that perhaps maybe more general practitioners or the medical world will start to now come up with some solutions that we can help treat jaw pain. According to the World Health Organization, a quarter of the population suffer from TMJ dysfunction. So it's a real thing, it's massive, and post-COVID, those figures have just only gone through the roof. And that leads me on to TMJ dysfunction and COVID-19. So scientific evidence now proves that COVID-19 pandemic has had a significant impact on the prevalence of TMJ dysfunction symptoms, anxiety and depression throughout society. I mean, it's not a surprise, but it's just bringing it back to our awareness of how the pandemic has impacted jaw pain. And I saw it during lockdown. A lot of my clients were reaching out because their symptoms were getting worse. But even post-lockdown, the uncertainty, the fear, the social isolation. There's a great study that's been published now of the impact of social isolation on TMJ dysfunction. You add the mask wearing. So, you know, how many of us are putting our masks on and holding it, not actually wearing it like the properly masked, having it under our chin, which is causing that strain on that area. And plus then if the mask is too big, like so many people use their chin to bring the mask up so that it's in its right position, which is just causing more jaw pain and more dysfunction of all those structures. Stress and anxiety, clenching, grinding. I am just getting so many client referrals now from dentists saying their clients are coming and grinding down their teeth at night. I mean, we're just getting more and more stress as a society, and it is now presenting itself as jaw pain in the body. Long COVID, there is now scientific studies suggesting that TMJ dysfunction is a symptom of long COVID. And I am also seeing a lot of people with similar symptoms as fibromyalgia, but that sort of fatigue, post-viral fatigue and related TMJ dysfunction. And then finally, the breathing difficulties. So those clients who have sadly experienced COVID-19 and the fact that they have had such difficulty breathing, tight chest, all of the airways have become restricted, that the jaw is being strained and it's becoming tighter and tighter and tighter, causing a number of lockjaw, trismus cases. And again, I'm treating a lot more lockjaws recently that sadly, people don't know quite what to do. And actually this whole body approach to lockjaw, to jaw pain, to TMJ dysfunction is proving so successful. So hopefully, you know, I'm able to help these clients, as all the practitioners who've done my course, they are now out there trying to help these clients just to soften, open and overcome their jaw pain. So there's no better time than now to be learning how to treat jaw pain, because it's just insane. So this brings me on to why do I use this whole body approach to TMJ dysfunction? Why do I live and breathe this whole body approach to TMJ dysfunction? The reason is that we are all connected by fascia. So fascia is the substance, the multicellular surrounding our structure, surrounding every cell, muscle, bone, nerve, blood vessel in the body. It's creating this three-dimensional web which spreads from head to toe. I describe it to my clients like a spider's web. It's a finite substance that surrounds our whole body, and through life, flies fly into your fascial web. So the fascia, as the flies come into the web, the fascia becomes restricted and tight, causing pain and malfunction. So the fascia becomes contorted, twisted, tight. There's less fascia available in other areas of the body as the fascia is migrating to that restriction area, which then causes dysfunction and very often jaw pain, dysfunction of the TMJ joint. So TMJ massage therapies uses this whole body approach to TMJ dysfunction, which truly believes that unwinding the fascia, or this fascial web or spider's web, whatever you like to call it, throughout the whole body using myofascial release, trigger point therapy and remedial massage can melt tension, reduce jaw pain and help clients return to health so that they can feel, heal and be 100% themselves in their wholeness. And that sort of captures, or that sentence really sort of summarizes what my treatment protocol is all about. And I just like to just show you this diagram because it just illustrates how we are all connected, and how if you keep a focus on the jaw area, how different areas of the body affect the jaw. So I just thought I would just show you that to illustrate. Let's have a look. I just love that little diagram or little animation, because it really does just highlight how we are all connected, and how if you move the foot in one direction, how the fascia moves and is affecting the jaw area. Hence why I use this whole body approach, and my treatment looks at the whole body and unwinds the whole fascial system to release the jaw. So I just thought it would be useful to outline a assessment protocol for TMJ dysfunction that you can use in your clinic, and certainly what I use and that we discuss in detail in the course. So there's so many different elements to jaw pain, to TMJ dysfunction. So by just looking solely at the symptoms in this area, we are tending to miss other areas of the body, of dysfunction, of facial restrictions. And so I like to start by having a client history consultation. I will then look at the symptoms, we will then inspect the joint, we'll palpate it, and just check the range of motion. And all these different elements come into my assessment protocol for TMJ dysfunction. So it is quite important that you have this idea that all these different elements come together to create a picture of what TMJ dysfunction look like for your client. So having had the client history consultation form or discussion with your client, and that's a really is a really important part, because you get to understand the history of the client, you get to understand the medical history, the emotional traumatic history of that client, all of which have an impact and a place significantly on the emotional well-being of the jaw joint. We then go to look at the symptoms. The symptoms of TMJ dysfunction include just a few of these, which these are the most common that I see in my clinic: tension headaches. If they feel they have a vice around their head and someone's just turning that vice. Jaw pains, they're waking up in the morning and they just feel like their mouth has done a marathon. It's tight, it's painful. Clenching or grinding of the teeth. So they're literally they clench, they're aware of their clenching, or perhaps they're not, and their dentist has told them that they're grinding their teeth. The dentist has issued a gum shield and they're just grinding through it, biting through it. So that, it's not a solution. Then trying to find some help really to try and help the grinding sensation, or actually mechanical grinding of the teeth. Neck and shoulder pain is another real common symptom. Pain behind the eyes, like a strain of the eyes. Ringing in the ears, very common. And an ear pain or pressure. So often I feel when my jaw is tight, I feel like a muffling in the ear, or the fullness of my ear. And then once I've released the jaw, that all just sort of melts away and dissipates. So having looked at the symptoms, then I would inspect the client, and particularly focusing on here, but also looking through the full body. So sometimes clients come to me with an asymmetric smile. So perhaps they feel that their smile is asymmetric, or they believe it, or they look in a photo and say, well, one side is higher than the other. What is that? A sign of TMJ dysfunction, most definitely. Swelling of the area, often you can see the masseter a little bit swollen, strained eyes. I can tell now a client who walks in who is suffering with TMJ dysfunction, because you can see it in their eyes, you can see it in their face. Teeth damage from grinding the teeth. Pelvic tilt definitely can have an impact on the jaw. And I look into this very deeply in our course, because I really believe there's this connection between the hips and the jaw. An inflamed masseter, you can see it when they've just got slightly swollen cheeks. And cheek biting, you can see like a little nodule on the side of your cheek when they are biting in. So all these things you can inspect. And then it's about palpating. So we're looking for lateral deviation when you're opening and closing the mouth, a clicking noise or a popping sensation, a pain when opening. So sometimes it's quite painful to open the jaw. It's often very tender to touch, particularly around the temporalis, around the ear. Restricted pterygoid, so actually the range of motion is quite limited. Tender temporalis, and then tight scaling. So the neck is very tight. And then finally, if we're still not quite sure, we can just check on the range of motion. So a quick way is the 3-finger test, and normal range of motion would be 3 fingers. Someone with trismus, probably a half a finger. And then we can look to see how that after treatment, how the symptoms are improving. And it's quite a nice way for the client to feel in control, and just to give them a bit of empowerment to say how much they are improving, and they are becoming freer in that area. This is just a checklist form that I developed after lockdown, because actually I was getting so many questions. Have I got TMJ dysfunction? Has my client got TMJ dysfunction? What can you just summarize what are the main symptoms, or how can I assess it? So I thought actually I'll just bring this little checklist together. And it's available to download for free on my website if you find it useful, and you can just literally tick it off, or it just gives you a sort of a nudge, I guess, just to remember all the different things that TMJ dysfunction, how it can present in clinic. Okay, so let's look at who is this CPD course for. So this is a 4-week level 1 online CPD course. And this course is for massage therapists, body workers, and any allied health practitioner who currently treats patients suffering from jaw pain. This course is for dedicated, passionate practitioners who are actively seeking and looking to expand their knowledge, skills, and who really want to learn a proven, non-invasive, whole body approach to TMJ dysfunction. I think it's quite important here to just reiterate really that this is a CPD course, and it is for dedicated, very skilled practitioners, body workers, massage therapists, fascialists, anybody who is treating with jaw pain, who really want to take their practice to another level, and who are perhaps are having clients come in complaining of jaw pain, not quite sure what to do. And that this course would be perfect for those therapists, practitioners. It isn't, it is quite intense, like we go quite deep into it and into the subject, but it is definitely, it's a level 1 course, but it's for dedicated practitioners. And different modalities could be interested in the course. The online course is open to manual therapists, sports therapists, osteopaths, massage therapists, chiropractors, physiotherapists, shiatsu practitioners, dentists, orthodontists, dental practitioners, dental hygienists. Anyone who is currently working with clients who suffer with jaw pain, this course is for you. So I thought I would just outline the learning objectives of the course and to see whether this is something that could be of interest to you. So in this 4-week live online CPD course, we will learn, or you will learn, how to assess and diagnose TMJ dysfunction in your clinic, perform a TMJ massage therapies treatment protocol. You will successfully treat a client with TMJ dysfunction using manual therapy and soft tissue techniques. You will learn how to perform advanced techniques for the medial and lateral pterygoids, the masseter and the temporalis. You will learn how to perform advanced techniques for the superficial and deep fascia of the anterior neck. And you will learn how to provide post-treatment exercises and self-care tips for your clients. You will explore the role of fascia in the body, the emotional and physical causes of chronic jaw and neck pain. You will look at the relationship between the hips and the TMJ, and the spiritual dimensions of body work, and then the body-mind split, and how this whole fascia, emotion, body-mind dimension can then manifest as jaw pain, and how actually by releasing the jaw, by releasing the mind and the fascial network of the body can actually soften the jaw. So we look at it from both angles. So the course content and structure. So each week you will be emailed the link to the website, which will have the different content outlined, the videos, and any additional reading as well. So in week 1, you will have what is TMJ dysfunction, a video. We'll look at the anatomy of TMJ, causes and symptoms of TMJ dysfunction, and look at the assessment of TMJ dysfunction. We then, on the Thursday of the first week, we will have a live Q&A Zoom session, which is an opportunity for us to get together as a cohort of practitioners, and also just to brainstorm, to talk and to discuss any of the content that was covered in that week. Then at the end of that, you will then need to complete a quiz for that week, and that will be submitted online before you then get the following week's content emailed to you. Week 2, we'll look at the treatment options, the fascia, emotions and hips, tinnitus, and then again have a live Q&A and followed by a quiz. Now these modules are backed up by an online downloadable guided workbook, but also you will be sent a hard guided notebook as well, which will sort of be the structure for the course, which you can take notes on and add any information that you want to it. So that sort of guides you through each week. Then week 3 is all things practical. So we will look at the tissue release, and then the TMJ massage therapies treatment protocol. And we will have a live Q&A Zoom session. With that, we'll also have a live demonstration. So any techniques or anything that you want me to go through, I will be able to run through those. I will have a body during that week 3, and we will just, look through it. It's really, it works really well actually, because I can just help describe or share the practice and the protocol with you, but you will have obviously had all the content that you will have covered in the week before seeing that live Q&A Zoom session. And then week 4, we'll cover self-care, reactions to treatment, and then red flags, followed by our live Q&A Zoom session on the Thursday evening. And then there will be also a quiz. So at the end of week 3, there is a case study for you to complete. And that will be a case study, a guided case study, which I will discuss with you in more detail, obviously, during the course. But so there's 3 quizzes for the assessment and then 1 case study, which will need to be completed before the completion of the course. So what is included in the course? This is a 4-week online course. So therefore you get 4 weeks of online tuition. You get 14 training videos, live weekly Q&A Zoom sessions at the end of each week. There'll be guided exercises and worksheets to enhance learning and knowledge, and then questions and quizzes to ensure understanding of key concepts. So the quizzes are there to just not necessarily assess, but more just to ensure that you understand the key concepts of the course. You will be sent a beautifully illustrated 60-page workbook that can be used to take notes, record learnings, and keep future reference. And that will also be available online as well if you want to have a downloadable version. There will be a practical online session focusing on the intraoral techniques and a TMJ massage therapies treatment protocol demonstration. You will also get access to the Facebook group to ask questions and connect to others. But what seems to be the most popular way of connecting is the WhatsApp group. And so each cohort, I'll set up a WhatsApp group for that group. And it's been fantastic because we've been able to really share knowledge, share ideas, share questions all over the world. So obviously the WhatsApp being that global group is fantastic. So share stories, and just it's a great way to connect with other like-minded practitioners. We'll have a meet and greet Zoom meeting at the start of the course, and then obviously the 4-week live Zoom meetings or live Q&A Zoom meetings as well. At the end of the course, I then offer a one-to-one Zoom catch-up, which is just a great opportunity just to have a one-to-one get together, a Zoom meeting, just so we can go through any questions that you might have that perhaps you didn't want to bring up in the group scenario. And just to really, just to get to know each other, and just for you to ask any questions that you might have. Throughout the course and afterwards, I will offer you ongoing support, and you'll have access to the group chats after the training group has completed. So after the training course is completed. So I've had 96 participants now who've done the level 1 TMJ massage therapies course, which is amazing. And we've now just got this sort of each cohort has a different sort of support network afterwards, and it's great. So we're actually generating this little community of jaw pain or TMJ dysfunction treatment lovers, which is fantastic. And so I'm always available to offer ongoing support if you have any questions, or if you'd like to share anything. I love that. So that is available after the course during the 4 weeks, but also afterwards if you would love to take part or only have any questions. At the end of the course, you will get a certificate of attendance on completion of the course, and you will also have an opportunity to feature on my new TMJ massage therapies practitioner register, which will help then promote your skills and your clinic and your treatments, but also it will enable jaw pain sufferers to be able to find practitioners who can help them worldwide. So often I get a lot of people asking me, oh, you're based in Cornwall, but I'm in Scotland and there's no one here I can't find anyone. And what I'm hoping is this register of TMJ massage therapies practitioners will then sort of cut that link, and people will be able to go and actually find practitioners who, because they are in so much having so much jaw pain, they'll be able to find fellow practitioners a little bit more easier. So that's that's about to go live any minute soon. So that's quite an exciting, again, another community thing of anyone who's really dedicated and passionate about treating jaw pain and helping clients with jaw pain. Then there is so many opportunities to come in the community, I guess, and we just together we will eradicate jaw pain around the world. So what do past participants say? I've just chosen a few of my testimonials from over the years, and this one here, Helen's TMJ Dysfunction CPD course is fantastic. It gives you theoretical and hands-on skills to assess and treat the TMJ. Helen didn't just stop there. She has formulated a protocol to enable us to treat the body as a whole. I found it incredibly useful in my role as a physiotherapist, and I've been putting it into practice with fantastic results. I would highly recommend this course. Helen, thank you so much, Helen, an inspiration and passionate lady. So it's great. You know, what I love about this course is that people are able to take it on and then go and use it in their clinic to help jaw pain sufferers. So it's not just a course you can just learn and, you know, just build your knowledge and go away and forget about it. It really is a usable protocol, which is great. Helen is so passionate and knowledgeable on the subject of the jaw and its relation to the body as a whole. It is not often you get someone with so much knowledge and compassion who can also train and teach. She delivered the online course brilliantly and is highly supportive and relatable. I feel like I have a bit of a mentor for life here when it comes to all things TMJ. The Level 1 TMJ Massage Therapies online course offered me an in-depth insight, not just to a TMJ treatment for the body holistically, but also offered a journey into how our lives, lifestyle, and habits can impact us physically. I think that's quite important, that one, because it just highlights this whole body approach, not only body holistically, but also how our lives and our lifestyle and our emotions and our relationships and all of that can have such a massive impact on the jaw. And yeah, it's great that Em was able to highlight that for me. I absolutely love this course. I was happy to find a course like this available online, especially since the pandemic. I was able to learn on my own time and safely. The content was easy to follow and the treatment protocol was a smooth transition into my practice. Helen was awesome at being available for questions to make sure everyone was getting the most out of the course. I thought I would miss the hands-on component of the course, but Helen did a great job with the video demo and then followed it up with a live call demonstrating any techniques anyone wanted a better look at or explanation. Overall, I would highly recommend this course. So Jerry in Canada, that's great, because although we're not able to physically be together in this course, there is so much opportunity for discussion and practical demonstration that actually almost feels like we are. And what's great is that I feel like Jerry is like a fellow friend, so although we can't be all together, how great that we are enabling this whole online world is enabling us to be together and to learn together and to help jaw pain sufferers. Helen is a great tutor and very passionate about the subject. The course was well structured very well, and the weekly Q&A Zoom session allowed for clarification and to dig deeper on specific topics. It was also great to meet fellow therapists during these sessions. The online course felt well-rounded and I enjoyed learning new massage techniques to add to my repertoire. I very much enjoyed the whole body approach to TMJ dysfunction and learning about various self-care modalities I can now recommend to my clients who suffer from jaw pain. A great course packed with so much information about the cause, symptoms and treatment of TMJ dysfunction. Thank you, Helen, for sharing your passion and knowledge so freely. So this is great. So Christina is now successfully treating clients with jaw pain. And it's so great just to hear her stories now and how she's out there helping other people and sharing her knowledge with jaw pain sufferers, which is amazing. An excellent, relevant and eye-opening course. Thank you, a chiropractor. So this is also great for chiropractors and anyone, again, working with jaw pain. So the key dates for the course, for the November course. So we have our meet and greet at 6 p.m. on Sunday, the 7th of November. This is an opportunity for the whole of the cohort to come together, say hi, just to find out a little bit more about yourselves, what you're practicing, what you're doing, where you are, and perhaps what you're hoping to learn from the course. Then After, on the Thursday of week 1 at 6 o'clock again, we will come together for our live Q&A Zoom session. And then week 2, week 3 and week 4, we'll have that Thursday 6 o'clock live Q&A Zoom meeting. Now, these meetings will be recorded and they will be uploaded onto the website portal. So if you are not able to be there in person, whether it's time zone restrictions or work or whatever that may be, not a problem at all. You can either email me any questions that you have before you'd like me to cover in those live Q&A Zoom sessions, or if you don't have any and you just want to catch up, you can go and catch up on the Zoom session at any time, at a time that suits you. So that will be recorded and will be available to be viewed and shared after the live Q&A Zoom session. And then on the week commencing the 6th of December, we will have that one-to-one Zoom catch-up, which is again an opportunity for me to meet you personally in one-to-one, and just to try and answer any questions that you might have or demonstrate any techniques that you might need a bit more clarification on. And then on the 19th of December, the course will go offline and all assessments would need to be completed by this date. I will then be able to issue you with your certificate, and you'll be able to come onto the TMJ Massage Therapies register, or TMJ Massage Therapies Practitioner Register, should I say, which will then help you to market your new skills. So that is the key dates for the November course. The registration is now live, so you can go to www.tmjmassagetherapies.com/training, and registration is now live, so you can come and join us there. There is a monthly payment plan if you wish to spread the cost over a few months. If that is the case, please get in touch with me and I can make it work for you. The deposit was due in August, but I can make that work for you, no problem at all. And then the closing of the registration will close on the 25th of October, just so it gives me enough time to send out the workbooks, consolidate the group, get the WhatsApp group all sorted, and we can just then be ready to go live on the 7th of November. There are limited spaces. Obviously, I can't have too many people taking part. So if you are interested, or you do think this is a skill that will help your clients, then please do register. And yeah, I look forward to meeting you. Okay, so that brings me to the end of the webinar. I will now go and take some questions, but I will come offline to take questions from you guys. If you are catching up on this webinar and you have some questions or you want to share anything, please just drop me a message, send me an email, or if you would prefer to organise a one-to-one Q&A or just a chat, then absolutely fine. Just drop me an email, helen@tmjmassagetherapies.com. And yeah, as I said, I hope that has given you a bit of a brief introduction into my course and into my journey, and for you to understand why I have why I'm here and why I'm so passionate and on a mission to share my journey and knowledge with as many people and practitioners, dedicated practitioners, as I possibly can. So lovely to meet you all. Thank you so much for your time, and I hopefully will meet some of you again very soon. Take care. Thank you. Bye-bye.